Thank you for joining Akash Healthcare's Facebook live chat session. Today we have with us Dr. Ashish Agarwal, Director Cardiology. Dr. Ashish, who is a highly acclaimed interventional cardiologist, is distinguished for his exceptional expertise and compassionate patient care. With an illustrious career spanning over 15 years, Dr. Ashish has established himself as a pioneer of interventional cardiology. Today, we will discuss about atrial fibrillation, the hidden rhythm problem. Sir, my first question is, what exactly is atrial fibrillation and why is it called a rhythm problem?
सो एट्रियल फिब्रिलेशन जिसे एब्रीविएट करके AF नाम से जाना जाता है, मैं सारे पेशेंट्स को बोलता हूँ दैट ये दिस इज़ वन रिदम विच यू शुड बी अवेयर ऑफ. दैट मीन्स पेशेंट को पता होना चाहिए कि उसे AF नाम की रिदम प्रॉब्लम है. सो फर्स्ट ऑफ ऑल, व्हाट इज़ रिदम प्रॉब्लम? रिदम एक हार्ट की एक एबनॉर्मल धड़कन होती है जिसमें कि या तो हार्ट रेट बहुत बढ़ जाती है जिसे हम टैकी अरिथमियास कहते हैं, या हार्ट रेट स्लो हो जाती है जिसे ब्रेडी अरिथमियास कहते हैं. सो नॉर्मल हार्ट रेट, जिसको हम नॉर्मल हार्ट की रिदम, जिसे हम साइनस रिदम बोलते हैं, उससे जो डेविएशंस होते हैं उसे अरिथमिया कहते हैं. दे कैन बी स्लो और फास्ट. सो एट्रियल फिब्रिलेशन की हम आज बात करेंगे. सो इट इज़ अ टैकी अरिथमिया. टैकी अरिथमिया मीन्स कि जब हार्ट रेट बहुत इरेगुलर हो जाती है, नॉर्मल हार्ट बीट एक रेगुलर इंटरवल्स पर आती है, एट्रियल फिब्रिलेशन में ये हार्ट बीट इरेगुलर इंटरवल्स पर आती है और फास्ट हो जाती है. दिस इज़ कॉल्ड टैकी अरिथमिया एंड इट इज़ द मोस्ट कॉमन अरिथमिया इन एल्डरली पेशेंट. In fact, the longer we live, the more is the chances of developing atrial fibrillation in life.
How can someone know if they have atrial fibrillation? So, are there any warning signs or symptoms?
Yeah, so some patients they develop symptoms. So as I told you, normal heart की जो rhythm होती है वो regular होती है. Means if you ask me how your heart beats, I will say it beats like dhak dhak dhak. So atrial fibrillation is a chaotic rhythm. Means every heartbeat comes at variable intervals. So it's like dhak 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 dhak. This is how the heart beats. So the symptoms it produces is something called as palpitations. So normally we know that our heart is beating 24/7, but we don't feel that our heart is beating. So this atrial fibrillation is felt like palpitations. The patient complained of like he is feeling that something, the beat is either skipping or it is missing, or he can feel that the heart is pounding so fast. Some patients who have atrial fibrillation since a long time, they usually at times adjust to this arrhythmia and may not develop some symptoms also. Now, how do we know this? The only way of diagnosing atrial fibrillation is to get an ECG done at the time of atrial fibrillation. So, अगर आप ECG करते हैं उसमें डिटेक्ट होता है कि atrial fibrillation है. That is how it is diagnosed. But some patients they have paroxysmal atrial fibrillation. I would henceforth I will call it as AF. So some patients have paroxysmal AF. That means initially कुछ लोगों में AF आता और जाता रह सकता है. That means कुछ टाइम के लिए AF हुआ, फिर वो नॉर्मल हो गया, हुआ नॉर्मल हो. That is called paroxysmal AF. So such patients may not have an AF detected in ECG at some time. But for such patients, if we suspect that the patient is having atrial fibrillation, we may ask for some test which is called as Holter, and that is how we detect and diagnose it.
Is this disorder dangerous or can people live with it without major issues?
It can be dangerous if it is left untreated. So there are two problems with AF a patient can face. Number one is the symptoms. As I told you, the patient may feel palpitations, उसे धड़कन feel हो सकती है. Second thing is the most important thing, that how it is dangerous to you. See, palpitations are symptomatic but they cannot be life threatening. Usually this rhythm per se is not life threatening, your life is not at risk, but in certain situations it can be life threatening. For example, atrial fibrillation means this rhythm arises from atria. Atria क्या होते हैं? हमारे हार्ट में 4 चैम्बर होते हैं और ऊपर के 2 चैम्बर उसे हम राइट और लेफ्ट एट्रियम बोलते हैं. So it is practically called, we in our language call it supraventricular. That means ऊपर के चैम्बर से आने वाली जो rhythm problem है उसे हम supraventricular बोलते हैं. So atrial fibrillation हार्ट के ऊपर के चैम्बर से निकलने वाली एक एबनॉर्मल रिदम है. अब इसमें क्या होता है कि नॉर्मल एट्रियम एक सिंक्रोनस फैशन में कॉन्ट्रैक्ट करते हैं. दिस इज हाउ दे कॉन्ट्रैक्ट एंड पुश ब्लड. एट्रियल फिब्रिलेशन में this contraction becomes chaotic. The atrium does not contract like this, they fibrillate like this. So what happens is, when the patient develops atrial fibrillation, they develop a chance of having clot inside the heart. हार्ट के ऊपर के चैम्बर में, स्पेशली जो उनका अपेंडेज होता है, उसके अंदर क्लॉट बनने का एक खतरा होता है. दिस इज व्हाट इज द प्रॉब्लम. So till the time that clot is inside the heart, the patient will not have symptoms. But of course, when we know that the heart is continuously pumping blood, so if the blood is having clot inside the heart, and if it dislodges or embolizes from your heart, it can go to your brain, and that is how it can cause stroke, or it can go to the periphery, your limbs, and it can cause gangrene. तो एट्रियल फिब्रिलेशन से प्रैक्टिकली आपके हार्ट में क्लॉट बनने का खतरा होता है, और अगर वो क्लॉट निकल करके ब्रेन में गया तो स्ट्रोक यानी कि पैरालाइज होने का खतरा होता है.
What are the common causes or risk factors that lead to atrial fibrillation?
So if we talk about causes and risk factors, there are certain, usually जैसा कि मैंने कहा कि the longer we live we are more going to develop atrial fibrillation. So the risk factors means rising age, in fact obesity. These are the risk factors for developing atrial fibrillation. Excessive alcohol intake can also cause atrial fibrillation. Any kind of acute illness, for example sepsis, pneumonia, or any kind of acute illness can actually cause a short lasting AF. But there are some structural heart disease. For example, some patients have some valvular heart disease. Heart के valve में अगर कोई problem आ जाती है, especially mitral valve में, तो patient को atrial fibrillation होने का खतरा होता है. So these are certain risk factors and causes for atrial fibrillation.
Does stress or lifestyle play a role in triggering atrial fibrillation episodes?
Yes. So atrial fibrillation, जैसा कि मैंने कहा कि हमारे वेट लाइफस्टाइल से इम्पॉर्टेंट करता है. इम्पॉर्टेंट उसका कोरिलेशन है. फॉर एग्जांपल योर अल्कोहल, सम पीपल दे टेक अल्कोहल, दे डेवलप atrial fibrillation. Sedentary lifestyle, those who have very sedentary lifestyle, they develop obstructive sleep apnea, जिसमें कि रात में सोते समय आदमी चोक हो जाता है. Weight, increase in weight, these are all the risk factors, and they are directly or indirectly related of course to your lifestyle.
How is this disorder diagnosed? Do we need special tests or scans for it?
So we don't need a scan for it. We diagnose it by ECG. If patient's rhythm is irregular, if you feel the pulse rhythm is irregular, it can be diagnosed by ECG only. As I told you, if you suspect that the patient may be having atrial fibrillation but not in a normal surface ECG, then we can ask for a Holter test, which is called as a 24 hours ECG recording. There it can be diagnosed.
What treatment options are available for it?
So the treatment depends upon what is the reason behind AF. Sometimes the patient have a reason behind. For example, I told you कि कुछ बचपन से कुछ हार्ट डिसीज़ होती हैं जिसको कहते हैं हम कंजेनाइटल हार्ट डिसीज़ या वेल्वुलर हार्ट डिसीज़, या कुछ पेरिकार्डियल या कुछ रेस्ट्रिक्टिव कार्डियोमायोपैथीज़ होते हैं जिसमें एट्रियल फिब्रिलेशन होता है. सो फर्स्ट ऑफ ऑल द बेसिक अंडरलाइंग डिसीज़ नीड्स टू बी ट्रीटेड, नंबर वन. नंबर टू, वी ऑलवेज classify this is how we treat that. We always do some risk scoring. If you go to a cardiologist and if somebody diagnosed as AF, so we always do some risk scoring. That means किस patient को स्ट्रोक होने का क्या खतरा है, उसके लिए हम कुछ रिस्क स्कोरिंग करते हैं जिसे हम चैट स्वेस स्कोर कहते हैं. अकॉर्डिंग टू दैट रिस्क we usually give you two medicines apart from correcting the underlying problem, for example diabetes, hypertension, some valvular heart disease or any underlying disease. Apart from that, we usually give two medicines. One, we give you a blood thinner that depends upon your risk of developing a stroke, that is decided by your chat score. Secondly, we give some drugs so as to control the rate of the atrial fibrillation, or we always try to convert the rhythm of the atrial fibrillation to normal rhythm. So your doctor may ask you to take two specific medicines, one to control rate in rhythm, another they will give you a blood thinner to prevent stroke.
Is atrial fibrillation linked to heart failure or stroke, and how can those risks be reduced?
Yes, so we have already explained that how atrial fibrillation can lead to clot formation in the heart and then it can cause stroke. Now we talk about heart failure. So of course some people they have already have weak heart, उनका heart already weak होता है और उनको atrial fibrillation हो जाए, तो these people they are not, because atrial fibrillation में heartbeat sometimes it goes up to 150 or even more. So these patients are not able to tolerate those high heart rate and they go into heart failure. So this is what I'm talking about, is the patient who already is in heart failure. If their heart rate goes high, they will decompensate, they will develop overt heart failure. But अगर किसी patient का heart normal भी है and if he continues to have very high heart rate because of atrial fibrillation, they also are at risk of developing heart failure, which is called as tachycardiomyopathy.
Can young or healthy individuals also develop this disorder?
So yes, young and healthy individuals, because of if they develop a poor lifestyle, as I told you that these substance abuse, taking drugs, alcohol, smoking, sedentary lifestyle, increase in the weight, they are all poor lifestyle and actually cause chances of atrial fibrillation.
What daily habits or lifestyle changes can help manage atrial fibrillation better?
So if we talk about poor lifestyle, then we do opposite thing. That means if the patient is asked to maintain a healthy body weight, that is the most important thing. We stay away from substance abuse or smoking and alcohol. That is the most important thing to do when you are suffering from atrial fibrillation or if you want to protect yourself from AF.
Thank you, Dr. Ashish Agarwal, for sharing such valuable information with us.